So I've heard that South Park did a great job of making fun of and properly representing the US healthcare system and how complicated it is to navigate it. And they do it in one of the most trending topics right now, which is incorporating obesity medicine. So we're going to take a look at a clip from this episode, react to it, and see how accurate it is.
Wow, look at this place!
Well, hello there! Looking to get some insurance?
No, my friend's mom already has insurance with your company.
Oh, great! You're here to pay your bill.
No, we're not here to give you money. We're here to file a claim for my friend's medication.
Oh, you want money from us? Right through that door over there. Hello.
Yeah, this is already true. So these insurance companies that have like billions of dollars, they have all these fancy tech-enabled services. But then when you're trying to file a claim or actually utilize some of what you should be owed given the amount of premiums you're paying, all of a sudden it's like insanely hard to get help.
We want to file a claim to get my friend's weight loss drugs paid for.
Oh, okay.
Do you want to know his policy number or anything?
Let me just speak with our medical director first. Yeah, okay. Sorry, but we don't pay for medicines for obesity because it's not a disease.
Who was that?
That was the medical director. The medical director decides what claims are valid for us to pay for.
But you didn't say who the patient was or what was wrong with him.
Right. The medical director's job is just to say no.
Look, my friend's mom has been paying you people for years, and his doctor says his weight is a medical concern and obesity is a disease. Oprah Winfrey said so.
Okay, calm down. I didn't realize I was dealing with someone who had so much determination. If you do a little more work, I think we can get you.
So yeah, this is true. I mean, it's really crazy that, and even as doctors practicing, you see this, where we might want to give a medicine, but it's the insurance company that has to decide whether or not they're going to approve it. We could still give a medicine without the insurance company's approval. The problem is then it becomes unaffordable for a lot of patients. And so if the insurance company doesn't approve it, in a sense, they're the ones that get to determine who gets what type of health care. There is a push towards approving more of these obesity medications because obesity is most certainly a disease. And if you were to run the analysis, and I think why some of them are starting to be more covered is if you can prevent someone from being obese, they're more likely than not going to use fewer healthcare resources down the line. If their weight gets better, their cardiovascular health gets better, probably their diabetes gets better. Sometimes you can even go out of the technical diabetes threshold. Your hemoglobin A1C improves when you see these weight loss. And there's a whole host of research being done now into the benefits of these weight loss medicines because of how effective we've seen them to be.
Your medication's paid for.
What, we can?
Yeah, you see, the doctors and the pharmaceutical companies and the insurance companies all kind of work together. So all you have to do is navigate the American healthcare system.
We're gonna navigate the American healthcare system. It's there for you and me.
Just fill out these forms.
We're gonna get better and we're gonna be strong and as healthy as can be.
I need to send you to imaging.
Let's navigate the American healthcare system.
Just fill out these forms.
I just filled them out the last place. It's so much fun to be getting it done.
I can't sign this for insurance. His original doctor needs to sign this.
We go back to the doctor to get that thing for insurance, then go back to insurance.
We need you to get a second opinion from a doctor who's in network.
We're navigating the American healthcare system. Now just watch us go. We're getting...
Yeah, also, depending on your insurance, if you're not even using an in-network doctor, very little, if any, will be covered depending on your insurance plan. So you need to make sure you're seeing an in-network doctor. What's crazy is sometimes, let's say, in case of emergency, there's usually stipulations, but you go to see a doctor and maybe there's only a few specialists on a specific condition that are out-of-network. You're going to have to see an out-of-network doctor. So really the amount of hoops you need to jump through to properly utilize your insurance, in my opinion, is a massive problem. And the insurance companies definitely make it a problem on purpose, because the more that they can prevent you from utilizing resources, in a sense, the more their profits are going to be. Now, interestingly enough, when the ACA was passed, a rule that you can't, I believe, have more than 20% of profits and 80% of the premiums need to go towards utilization of care. However, what do you think insurance companies will do if they're only allowed to get 20% of the pie? Well, they just make the pie bigger. And so premiums have actually been going up as a result. That amongst many other more complicated factors. But unfortunately, one of the unforeseen effects of the ACA was that, in a sense, it drove premiums up, at least from this perspective, because insurance companies are then incentivized to have higher premiums because they're only technically allowed to make 20% of profits, and thus they want to make the whole pie bigger so that 20% is bigger.
Things done, taking care of our health.
We need these filled out and then faxed to your insurance company.
We're filling out forms, and we're scanning those forms, and then we're emailing those forms to get them back to insurance.
We need confirmation from a different specialist.
Let's go and navigate the American healthcare system. It's the best system of them all. No, we already talked to the insurance company. They were supposed to talk to you. And we go back to the doctor, we go back to the specialist who talks to the insurance company, the faxes, the medical advisors on the phone in the morning. And we're going in one place and we're coming out the other place. And we're back over here now, and I was just over there. And I'm getting confused, and it's getting dark. And my mind is all different colors, and I think I'm lost. Hey, fellas, I think I'm lost in the American healthcare system. Fellas, help!
Yeah, I'd say that was pretty accurate. And you know how they're showing the medical director saying no? What's even crazy is there was cases where insurance companies were utilizing AI to essentially find ways they could justify just saying no to claims, even if that was not properly justified. So there's going to be a lot of litigation and investigation into the tactics that insurance companies use to prevent people from accessing the care that their doctors a lot of times are the ones recommending. But with that said, if they're just getting fines, then to them that's just an extra expense on their profit loss statement at the end of the year. So yeah, I'm not the biggest fans of how insurance companies operate in this country. I think that we need much more transparent pricing and a lot less power that the insurance companies have in how they get to determine which care you utilize. And one of the ways they justify it too is you'll have a peer-to-peer where, let's say, a neurologist wants to prescribe medicine. They're supposed to speak to another neurologist who works for the insurance company to justify why that is if, let's say, that medication was denied. But a lot of times, one, the doctor that works for the insurance company, their incentive is to try and preserve the insurance company's profits. And so they're trying to ration care. Now, I'm not saying rationing care is always bad. You don't want unnecessary tests. But what's even crazy is sometimes you're talking to a peer that's not even actually in that specialty. Different states, I believe, have different laws for that. But it's really a crazy system. And how we're going to fix it, I don't know. But I think a good start is education. And even as crazy as it sounds, a South Park video like this that will spread the word and can put some comedic relief to it, I don't necessarily think is a bad thing. So I'm interested to watch the rest of the episode. If you want me to do a further response video on other segments of the episode, let me know in the comments below.